All right, it is now 11 a.m. and we have granted the appropriate recording permissions. So Dr. Vanderhoff, I will go ahead and hand it over to you.
Thank you very much. Good morning. Appreciate everyone joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Last week, Governor DeWine addressed the dire situation our hospitals are currently facing, a situation which since then has only escalated. Our hospitals are literally pleading with members of their communities to choose to be vaccinated. The simple facts are that when our hospital staff are facing what they are now facing, emergency room waits can be extended and planned surgeries and treatments may be postponed. This means people arriving at the emergency room for things such as fractures, acute injuries, even heart attacks, may have to wait because rooms and staff are occupied with patients with COVID-19. All of us, regardless of where we live in Ohio, need to work together to take pressure off our hospital systems so they can continue to give us the best care possible when we need it, whether we're someone with a broken bone, a car accident, or suffering a stroke. However, when people flood emergency rooms looking for COVID-19 tests or are severely ill with COVID-19, it makes it difficult for everyone to get quick access to the life-saving care they need. Yesterday, we reported an all-time high of COVID-19 cases, with 12,502 cases seen within the previous 24 hours. That same day, there were close to 4,797 people fighting COVID-19 in our hospitals, more than 1,200 of them in the ICU, and almost 800 on ventilators. All these patients require time, staff, and resources that are above and beyond what our hospitals are accustomed to handling this time of year. With these numbers, we have a troubling picture, one that should be a wake-up call for every Ohioan as we think about our risk of getting sick with COVID-19, especially as we think about gatherings with loved ones for the holidays. And I think with that in mind, it's important for us to remember that not all cases of COVID are the same. There's a real difference between getting COVID-19 if you're unvaccinated versus getting it if you're vaccinated, especially if you're up to date with a timely booster. While there is a chance, particularly with the Omicron variant, for a fully vaccinated Ohioan to get COVID-19, the good news is that when you're vaccinated, you can feel confident this holiday season that because you're vaccinated, your risk of developing severe disease, especially the kind that lands you in an ICU, is very low. The same is not true for the unvaccinated, remembering that it's the unvaccinated who are filling our hospital beds. The fact is that if you're vaccinated and contract COVID-19, you'll probably have milder symptoms, if you have any, symptoms that are more like a cold or symptoms for sure that are very unlikely to place you in a hospital. However, if you're unvaccinated, you're not only at greater risk for getting COVID-19, you're much more likely to develop a severe case of COVID-19, one that leads to hospitalization or death. Sadly, yesterday alone, there were 584 new hospitalizations reported among COVID-19 patients. Now, we should all be very concerned by the tidal wave of COVID-19 hospitalizations, which, again, are driven largely by unvaccinated Ohioans. The Delta and the Omicron variants are both highly contagious and spread easily when you cough, sneeze, or even talk. And when you aren't vaccinated, you're at particularly high risk for being infected with the virus. And whether you end up in the hospital or worse, really is a roll of the dice. COVID-19 is relentlessly seeking out those who are not well protected. And choosing not to be vaccinated is simply a gamble with your health. Are you willing to take that risk or be the reason why a loved one takes that risk? Please get vaccinated. If it's time, get your booster and use preventative measures to protect yourself and others. The reason our hospitals are pleading with Ohioans to get vaccinated is because their firsthand experience tells them that the vast majority of COVID hospitalizations are, in fact, being driven by the unvaccinated. And hence, those hospitalizations are preventable by vaccination. Our hospitals need our help now. Now, while vaccination is crucial, it won't relieve the pressure immediately because full immunity takes a little time to develop. That's why Governor DeWine has taken decisive action now with a two-pronged strategy to help alleviate the pressure on our hospitals. First, the Ohio National Guard is in the process of deploying more than 1,000 Guard members in our hospitals with particular focus on our very hard-hit northern counties. We anticipate that nearly all 150 clinical staff and an additional 600 non-clinical staff will be deployed by the end of the week. The remaining 300 non-clinical staff are expected then to be deployed during the next week. This strategic deployment will allow the Ohio National Guard to support large hospitals that can expand their services and accept transfer patients, which in turn will alleviate pressure on smaller and rural hospitals, allowing them to move patients to the larger hospitals. Essentially, the Ohio National Guard is allowing us to staff up the bigger hospitals so that we can continue to load balance, as our hospital zone system has allowed us to do so well throughout the pandemic. The deployment will, of course, happen in waves, with exact hospitals and locations being finalized as the program rolls out. Today, we're sharing information about hospitals that will be included in our initial deployment. Keep in mind that we'll continue to monitor and to adjust our efforts as our workforce and our program is designed to be agile. At this time, our initial deployment plans will include the Guard being deployed at the following hospitals: Mercy Health St. Elizabeth Hospital in Mahoning County, Mercy Health St. Joseph's Hospital in Trumbull, Cleveland Clinic Akron General Medical Center in Summit, Cleveland Clinic Mercy Hospital in Stark, Summa Akron City in Summit, ProMedica Toledo in Lucas County, Mercy Health St. Vincent Medical Center in Lucas County. Now, more hospitals are being actively evaluated and will likely be added as the needs dictate. The second prong is finalizing supplemental support with ProLink, a staffing company that will bring out-of-state medical support into Ohio. Now, much like the strategy with the Ohio National Guard, bringing in additional staff will open up beds and enable larger hospitals to accept more transfers. The Ohio National Guard deployment must be very thoughtful and strategic. And as such, we've started that deployment in the area of highest need, which is the northern portions of our state. For example, the Guard is already helping out at Summa Health, who requested support in their emergency room. The Cleveland area hospitals told us their emergency rooms were being inundated with people trying to get COVID tests. At their recommendation, we collaborated to open a testing site. Now, thanks to our rapid deployment of the National Guard, we were able to very quickly activate a testing clinic. And demand there has been very, very high, with more than 1,000 tests administered yesterday, just as the site was launching. Of course, one day, a brand new site, we faced limits regarding what we could do. Rest assured, we're working, and we'll work every day to increase the capacity at that testing site. Now, it's important to remind everyone that there are many other testing opportunities available statewide, including at local retail pharmacies, some medical offices, community health centers, or at urgent care centers. Rapid testing kits are available for purchase at many groceries and pharmacies, and they're available for free at many local health departments and public libraries. Ohio was the first in the country to really use at-home test kits to make testing widely accessible, and the first to do it in libraries. Since January, ODH has distributed more than 5 million testing kits, with 1.2 million of those being distributed in December alone, all in an effort to make tests more available as we head into this holiday season. So before you gather this holiday season, or if you're experiencing symptoms of COVID, know that you have a range of options to get tested. And if you're visiting a library to pick up a test, please remember that these are people who have gone above and beyond to provide a service to their communities, distributing millions of tests statewide. So please be kind, say thank you, and know that out of concern for their communities, they volunteered to distribute these tests to help keep all of us safer. Now, joining me today is Major General Harris, Adjutant General of our Ohio National Guard. General Harris, our Ohio National Guard members, like any new member of a medical team, can't just show up and jump right into a hospital or testing site to go to work. What happens now during pre-deployment and training? What are they doing now to prepare for their mission? And I believe we have some video to share while you explain that process.
Yes, well, thank you, Dr. Vanderhoff. And by the way, thank you for the tremendous public service that you provide and continue to provide for the state of Ohio. You're right. As we transition these individuals from citizens to soldiers, citizens to airmen, there are a myriad of things that are required in order to make that transition. We process them with the intent that they're going to be on duty for an extended period of time. We're not sure what that is yet. We'll base that on our response to the disease, and quite frankly, track the disease across the state and the demand signal for our forces in the various hospitals. But we have to first, we verify some of the most basic information, like their emergency contact information and the things that you would expect us to do, but also because the work that they'll do in hospitals requires additional screening, so to speak. We want to make sure, for example, that their CPR certification is up to date. We want to make sure that they're properly HIPAA trained so that we don't compromise patient information. So we've put together, in coordination with your team, a list of those training requirements, in addition to those military things that we do to ensure that their pay is proper, that they're properly administered, and that they're properly equipped for the mission, proper uniforms, if scrubs are required. So some of it's mission-based, based on the hospitals they'll work in and which partners we're working with. And some of it's simply based on the basic requirements for working in hospitals.
Well, thank you, General. I'm sure a lot of people wonder a little bit about Guard members. Who are they in terms of their background, and what are the kinds of jobs that they'll be doing in healthcare to help with this response?
Well, we have two categories of people that we've brought on for this response. That the first category are those medical professionals, those clinicians, so to speak, that'll be doing bedside care. Most of their military skills will transition into the skills that they're using in the hospitals. For example, nurses, our EMTs, and the work that they'll be doing in some of the emergency departments. Those military skills transfer directly over, and we'll be keeping them in a medical capacity. I will tell you that we have to be very careful with those individuals because we don't want to degrade the work that's already being done in the hospitals by mobilizing nurses and doctors and other medical professionals and take them away from their civilian jobs to bring them onto duty and put them in another hospital. So we're being very cautious about that. The other category of people that we're bringing on are what we call the non-clinical folks, and they're the ones who will cover a variety of tasks inside the hospital facilities. It might be something as simple as helping clean surfaces. to transporting food, helping transport patients, anything we can do to take the load off the clinical staff so the clinical staff can focus on patient care and primarily that strain on patient care that's been created by the load of COVID patients that they have in the hospitals. Testing is another thing. We will, as you mentioned, we've established a testing station in Cleveland, and we anticipate more of those sampling testing missions in order to take the load off those folks who are showing up at ERs and other places in the hospital to get that testing done. So what they're doing in the hospital will probably, those non-clinical folks, not translate very well to what they do in the military, but they're tasks that can be trained very easily. But to answer your question, our folks, one of the things that makes the National Guard great is not only do they have their military skill that they're trained on, but also their civilian profession, and it covers every walk of life. We're a microcosm of Ohio, so a person may be a jet engine mechanic in the National Guard, and they could very well be an accountant in their civilian profession. One of my favorite examples is Steve Markovich, who he's retired now, but he's an F-16 pilot in the National Guard, and he was the CEO of a hospital in his civilian job. So that vast array, basically the dual mission of the National Guard, that double capability of our folks, not only their military skills, but their civilian skills that they bring to the National Guard really increases our flexibility and our agility. And I want to add, Doctor, that's something that's very important to us. We're building agility into this mission set. So we're putting the right command and control headquarters into place so that as the disease shifts around the state, as we may see surges or hotspots in various parts of the state, we'll be able to very easily, very quickly shift our resources in response to that. So again, the skills that our National Guard personnel bring, both their military skills and their civilian skills, is what really gives us the ability to respond in the rapid fashion that we have for the state of Ohio.
Well, thank you, General Harris. Thank you for your service and that of your entire team. This is just one more time where we see how important the Guard is, and we're so grateful for their ability and willingness to step into the breach. So thank you so much.
And if I could, just for a moment, sir, I'd love to also add my thanks, not only to the National Guard members, but for their families and employers. Our folks who reported to duty on Monday, that is not what they were anticipating doing on that Monday morning, and certainly not what their families and employers thought they would be doing over this holiday season. So I'd be remiss if I didn't express this model, this way the National Guard responds would be impossible without the support of the families and the employers that mean so much to us. So thanks to all of you.
Yes, very well said. Thank you. And, a profound thanks to the families and employers. Absolutely. Next, I'm joined by Dr. David Custodio, president of the Summa Health System, Akron and St. Thomas Hospitals. Dr. Custodio, you're experiencing a really profound number of COVID-19 hospitalizations in your area. Can you tell us what it's been like in the hospital and what the impact has been of this on non-COVID patients who are seeking care? Doctor, you're on mute.
It wouldn't be a Zoom meeting without a challenge on the mute button. So we've got that out of the way. Thank you. So first and foremost, I want to say thank you for the opportunity to join today to talk about what's occurring here. Thank you, Major General Harris, for your work and assistance. We are very much hit here in the Akron region. To date, we've treated over 10,500 patients for COVID in emergency department and inpatient settings. And as I just looked, we have 190 patients currently in our facility. That means 1 out of every 3 beds of our capacity is occupied by COVID patients. 52 of those patients are in the ICU. The other 140 or so are remaining in the hospital on the med surge beds. What we see is over 90% or about 90% of the patients that are admitted to the hospital are unvaccinated. And what we're seeing in the ICU, less than 2% of those patients in the ICU are vaccinated, meaning not only are we keeping the vaccinated folks out of the hospital, we're keeping them out of the more critical areas of the hospital. And the impact that we're seeing is not just with the COVID patients, right? Those beds are being occupied, and as a result, we have backups in the emergency department. So folks, whether they're arriving for emergency care for COVID or other emergency care, as you alluded to, for fractures and the like, they are profoundly impacted. We have over 30 patients boarded in our emergency department, waiting hours and sometimes days to get a bed upstairs, which impacts the ability of our emergency departments to care for those patients that are coming on. That means not only the COVID patients, but our EMS personnel who are arriving are experiencing prolonged waits, and that has a significant impact. Not only are the patients in our emergency departments and hospitals being affected, patients in the outpatient setting, because of the need for capacity, we have postponed any procedures that aren't emergent or urgent that require an inpatient bed. So folks who have been waiting for new hips or cardiac procedures are no longer able to do that. They've been postponed multiple times throughout this pandemic, and we're looking into next year before we'll be able to do that.
Thank you for that, Dr. Custodio. We mentioned that the Ohio National Guard has been deployed to your Akron campus to help in the emergency department. Can you share with us a little bit about that support and how it's helping?
Yes. First, again, thank you very much for the added support. Our emergency departments have been overwhelmed in providing not only care for the emergency patients, but also those admitted patients. We received 8 new team members on a Monday morning and onboarded them very quickly. They are EMTs and have stepped up to the plate. Our emergency department director is thrilled. These folks are eager, ready, willing, and very much capable to step into the care. They have decided to split shifts, allowing us to have double coverage at our peak hours in the emergency department. And they're providing care all the way from helping us in triage as the patients arrive, to drawing bloods, transporting patients, and step up to whatever task is available, even if it's wiping down a room or helping folks lift patients. Those folks have been very much received, and the home team is truly grateful to have this assistance at these dire times.
Dr. Custodio, you repeated the observation that these COVID hospitalizations really are substantially being driven by the unvaccinated. What can members of the community do to address that or help with that?
Well, thanks for the opportunity. It's very important that they understand that vaccines do indeed work. You may get sick, as you mentioned, but what we see, the evidence is very clear that it prevents hospitalizations and it prevents deaths. And at a 1-year anniversary of when the vaccines became available, it's literally devastating and heartbreaking that we are in this condition that we are now. These deaths are preventable. So community members, if you're not vaccinated, get vaccinated. If you've been vaccinated but not boosted, get boosted. And then the same thing that we've been saying all along, wear your masks, socially distance, avoid large gatherings. This is going to continue if we don't practice what we need to do. And so I'm begging on behalf of all of us and healthcare workers that you do what you need to do to help protect us all. Our teams are overwhelmed, quite frankly.
Thank you, Dr. Custodio. Really do appreciate your message. Finally, I'm joined by Dr. Jennifer Wall-Forrester, Associate Chief Medical Officer and Infectious Disease Physician at UC Health. Dr. Forrester, with Omicron now clearly taking over from Delta, we're hearing a whole range of things about this new variant. Can you tell us why it's still important in the face of Omicron to get vaccinated and to keep vaccinations up to date with a booster if they're due?
Yeah, and again, I'll add, thanks for letting me join today. If you haven't been vaccinated, right now you're at more risk because of how fast and easily this variant is spreading, like you mentioned. Getting vaccinated decreases your risk of death and ending up hospitalized with lasting effects. We haven't mentioned long COVID symptoms even yet. Secondly, as this virus is able to spread between non-immune or vulnerable people, it can mutate again and again. This is what viruses do. Because of these mutations, the Omicron variant has developed some changes in the spike protein that has made us more susceptible. That, paired with time and waning immunity, may be why we're seeing some vaccinated people catch this variant. But again, they don't become sick and do not die. So the booster helps get our antibodies back up high enough to fight the virus. Even if you do catch the virus, when antibodies are high, like I said, your risk of dying or getting sick is really low. Also, vaccinated people with good levels of antibodies don't spread the virus to others as much as non-vaccinated people. So another good reason to get the booster. To those who have been hesitant to get the COVID vaccine, hopefully the past year, you have been able to see firsthand evidence of how vaccines have been safe and effective for your family, your friends, your neighbors, your colleagues, and are ready now because vaccines really are the way out, that in the way everyone can do their part to help us find our path out of here. No one wants this pandemic to go on any longer. Let's get these National Guard members back to their families as soon as we can.
Yeah, thank you, Dr. Forster. People throughout the pandemic have understandably wondered about vaccination versus natural immunity or immunity that we get from infection. And we're now looking at yet another variant. And the question is arising frequently that I'm fielding about, hey, with Omicron now on the scene, how does the immunity that we gain from vaccines, particularly boosters, compare with natural immunity in terms of protecting us from the new Omicron variant?
Right. So, and this is a tricky question that, again, we are learning more and more about all the time. But it certainly depends on when someone was initially infected with COVID, and obviously then which variant they had, and to figure out how well they're protected now. As we've seen with vaccinated individuals, it also depends on when they got their original dose series. What studies have shown regardless, though, actually within the United States and in other countries, is that those who have already had COVID are even much more protected once they are vaccinated. It's so much higher at that point. Again, this is why the vaccines and boosters are needed now when this variant is being transmitted quickly, unfortunately, efficiently, from person to person. So whether you've had COVID before or are lucky enough to this point to have avoided it, it's a great time to get boosted, especially as we're moving into decreasing some of our ability to do those other protections that we've done over time. We have learned that ventilation and being outside can decrease transmission. And again, in most of Ohio, it's chilly, and most of our activities are going to be indoors. So again, we're kind of decreasing that ability, or one of those layers of protection. And so if we can all add on the protection of vaccination, that can again help us all get through this together.
Yes, thank you so much, Dr. Forster. Well, we continue to be, as we've all shared with you, in a very serious situation. However, we all have access to a powerful tool that can strengthen our protection against severe COVID-19. And that protection is the vaccines. And that protection is strong even in the face of the Omicron variant. If you haven't yet chosen to be vaccinated, please get the facts about the vaccine. When you choose vaccination, you are protecting yourself in a powerful way from the risk of severe disease, especially hospitalization and death. And you are helping your community, you're helping your family, you're helping the people you care about. If you're eligible for a booster, there is simply no time like the present to get your booster. If you haven't yet been vaccinated, there's no time like the present to get vaccinated. It will help your body fight COVID-19, particularly the new Omicron variant. This season, please think about the steps you can take to prevent COVID-19, especially before you gather with people you care about. Vaccination, testing, staying home if you're sick, masking, proper ventilation, regular hand washing, all of these are the tools that can help prevent the spread of not only COVID-19, but the flu and other respiratory viruses this holiday season. Finally, if you have symptoms of COVID, including cold-like symptoms, or you test positive, it's important to isolate yourself from other people to prevent further spread in the community. Remember, even if you have an asymptomatic or mild case and go out into the community or attend gatherings, you could be responsible for further spread of the virus. even if you get a mild case, you could pass the virus along to someone else, someone who might end up with a much more severe illness. And you have to think about what the impact is to your health as well as their health. So if you aren't feeling well this holiday, please ask yourself, is it really worth going to the event? Is it really worth going out? Thank you to my guests. And now I think we can take questions, Alicia.
Thank you, Dr. Vanderhoff. Our first question today is from Allison Walker with WKEF.
Hello, everyone. Thanks so much for taking the time today. My question is for Dr. Vanderhoff. We all know that Senate Bill 22 is in effect, but do you foresee implementing any mandates or restrictions if new cases continue to break records in the coming weeks?
Well, I think we're at a place in this pandemic where we've had a remarkable response from so many Ohioans. Yet, if you look at the vaccination rates in our state, we're now at close to 70% of our population has begun or completed their vaccine primary series. That's really remarkable progress. In fact, as I look back over the last 2 months, throughout November and December, we've been averaging per week 60,000 or more people showing up to start their vaccine series. That's very encouraging. There simply is a place in any pandemic, in facing any kind of community threat, where it really falls to us as members of the community to make the smart and right decisions, to take the common sense steps we need to take to keep ourselves and each other safe. And I think we're going to continue to remind the community of that and encourage those steps, because we're all in this together. And as we're all in this together, I don't want us to lose sight of the fact that people are stepping up. People are doing the right things. And we want to encourage them to continue to do so.
Thank you, Dr. Vanderhoff. Our next question is from Josh Rutenberg with Spectrum News.
Yeah, Dr. Vanderhoff, you just got done saying about this remarkable response that people have had and people using common sense, yet here we are and the state's pulling out all the stops because the hospitals are overrun because people won't get vaccinated. So do you really think that the people that are firmly entrenched that say that they won't get vaccinated are going to have any sort of sympathy for the people in the hospitals right now? Are they going to use that common sense without being forced to get the vaccine?
That's a great question. And I would say that I sure hope they will. And I have reason to be hopeful. As I look at the vaccination rates here in Ohio, and I compare to where we've been through November and December, and I look at that in comparison even to October or September, it's clear that there has been a very significant uptick in the response. People are hearing the message. People are getting the message and taking action. When we look at most vaccine programs and we look at the place we are in now in terms of the number of people showing up, again, it's really rather remarkable progress. And more importantly, the response of Ohioans over the course of the past 2 months is what is particularly encouraging. So I really want to just continue people to respond. And I do think people are witnessing what's happening in their communities and realizing that it can hit them. It can hit people they care about. And so I think that has a lot to do with our much more recent response over the last 2 months.
Thank you, Dr. Vanderhoff. Our next question is from Andrew Welch-Huggins with the Associated Press.
Hi there, and thanks for doing this. My question is for Dr. Custodio and Dr. Forrester. As the hospitals are filling up with unvaccinated COVID patients, we're hearing anecdotal reports of some family members of these patients demanding unproven treatments like ivermectin, calling the COVID diagnosis into question, and generally harassing already overworked staff. So my question is, what can you tell us about such incidents at your hospitals, and what are you able to do about them?
So thank you for asking that. Workplace violence in the hospitals has always been a challenge. And during these times of high stress, where loved ones are in the hospital, we're seeing more and more frustration with this. And yes, on a regular basis, some family members, not all, but some in those highly charged situations, do not treat our employees with the kindness that we would expect as we're working to save their lives. So we have in place a no tolerance for that sort of behavior, and we have opportunities to address that behavior with both our protective services, but with our staff in and of itself. It's an unfortunate consequence, but it is occurring, and we as scientists and providers cannot administer treatments that aren't indicated and that can in fact do harm. So we'll continue to provide the care. Healthcare workers by nature are some of the most compassionate and caring people you will ever meet, and we'll continue to do that way, even if we're not treated that way in kind.
Yeah, I second what Dr. Custodio mentioned. Also, we've experienced some of this ourselves, and one of our coming out of that, we've really tried to support our frontline staff with executive support, but even support for the family as well. Clearly, they're going through a hard time, like you mentioned, and if we can get them with the best information from experts in whatever field, whether it be pharmacy or chaplain care or infectious disease, knowledge. We have a committee to kind of put together that to, again, help support the family and help support the frontline staff.
Thank you, Dr. Forrester. Our next question is from Laura Hancock with the Plain Dealer in Cleveland.com.
Hello, with the Cleveland drive-through testing site, can you guys describe the changes, if any, were made to ensure that more people could get through today? You said 1,000 PCR tests were administered. Do you anticipate more? Yesterday, they had to, because of traffic impediments, they had to stop taking new people at noon. So I was just wondering how today you've addressed that, and if you're still considering opening up another off-site site.
Well, thanks for that question. So the response at that site clearly demonstrated the hunger, the demand for these tests. And, we're actually very pleased that on the very first day of a brand new offsite testing facility, we were able to provide testing for over 1,000 people. But what we are doing each day is looking at what we're learning on the ground, and then having a team that meets and reviews and identifies any opportunity that we have to expand that capability, including what opportunities do we have to expand the people that we have working there. So we'll continue to look at those opportunities on a day-to-day basis. There obviously is some limit to what any given site is going to be able to do, or how many members of the Guard and other human resources from local health departments and health systems we can deploy there, because we also have to be focused on the hospitals and the support that we're providing there. And we don't want to compromise that part of the mission. General Harris, other perspectives or ideas that I might not have hit on?
No, Doctor, I think you said it very well. At some point we'll have to consider other locations to relieve some of that stress. I think there are certainly physical limitations to the number of vehicles that we can push through there in any given hour. We will augment that staff with additional Guard members, and some of this will depend on our mission partners too. This is a site that we're there to support the Cleveland Clinic and university hospitals and other clients. So this will be a collaborative approach to determine. Certainly won't be the National Guard that determines if we open another site. That'll be up to our mission partners, but we're committed to putting the resources there. But again, there will be physical limitations to just how many vehicles you can run through that site. within an 8 to 12 hour period. So that analysis is being done now. I can tell you the teams met yesterday. They were on a call again as early as 6:30 this morning, sorting this out. But we're committed to optimizing the number of cars and Clevelanders that we can push through that site. I'm not sure what that number is yet.
Thank you, General Harris. Our next question is from Caroline Sweeney with WEWS.
Good morning, everyone. Dr. Vanderhoff, when you saw the all-time high numbers come in yesterday, what are your thoughts looking forward for trends in these numbers now that we do have these large offsite testing opportunities for people in the Cleveland area? And then Dr. Forrester and Dr. Custodio, when your staff members see these record high numbers, what kind of impact do they have on them with these frontline workers seeing these trends day to day?
Well, thanks for that question. And I'll start, at a time when we know we are seeing activity both from the Delta variant, which of course has driven our surge in hospitalizations over the preceding weeks, and the rise of the Omicron variant, which in parts of the country now is clearly emerging already as the dominant variant. And knowing that that Omicron variant can have a doubling time that is incredibly fast, as short as 2 days. Think about that the number of cases you're looking at might double every couple of days. It was fully anticipated that we're going to see those case numbers get to very, very high levels like we saw yesterday. I think the key for us is going to be watching what the impact is on hospitalizations. And there are many factors that play into that. We've spoken today about some of those factors and spoken about some of the important steps each and every one of us really do need to take now to help decrease that risk that we become one of those hospital statistics. Most important, which is vaccination. But I think it's very hard to make predictions about where things are going. There are some hopeful signs. We've received reports today. I read reports that were shared by AP regarding cases in South Africa, which now seem to be dropping in a sustained way. That's very encouraging. We're also seeing from the South African experience that the Omicron variant there was in fact associated with much less of a burden of hospitalization. However, will that translate to countries like the United States that are older and have many other situational differences? We don't know yet. So a lot to be learned. Let me turn to my two colleagues to see if they can answer the second part of your question.
Sure. Thank you. Thank you for the question. I alluded to it already, what our healthcare force is seeing. These folks, what they have done and continue to do over these last 20 plus months is truly outstanding. But everyone's human and they are fatigued, they're overworked, they're tired, and most of all, they're discouraged because we know, as we've said several times, this is preventable. And that a lot of these deaths and hospitalizations that we see shouldn't be happening. And the impact upon our caregivers families who are going through this with them, on the community and as a whole is palpable right now. It's a lot different than the first time through. And now on wave 5 or so, it is particularly challenging for our frontline workers. And we applaud them, we thank them. We can't say enough for all the folks that are helping us get through this.
And I'll add, healthcare workers are some of the most caring and clearly resilient groups of people that are out there. But I won't sugarcoat it either. I'll agree, it's disappointing. While in Cincinnati, we may not be seeing the numbers that the Northeast is seeing yet, we know it's coming. But I think what I feel as a healthcare worker and others is honestly, we're worried that given the stresses, we're not going to be able to provide the care that we want to provide to each and every one of our patients with the limited resources more patients to take care of with those resources. And that's what's really disappointing and frankly worries me and is scary to healthcare workers too. Whether they're COVID patients or, as Dr. Vanderhoff mentioned, every other patient coming into the hospital.
Thank you, Dr. Forrester. Our next question this morning is from Titus Wu with the Columbus Dispatch.
Hi, Doctor. I guess first I just wanted to clarify that you said that the company in which Ohio is looking at in terms of bringing more staffing and out of state nurses, the name is ProLink, and then also just wanted to follow up on that, just asking kind of so far what the status of discussions are with ProLink, if that's the company's name, and maybe if you guys have better estimates of how many more out-of-state nurses are coming in.
Well, yeah, thank you. Yes, the name of the company is ProLink. What we've attempted to do as the Department of Health has been to simply translate a very productive relationship that the Ohio Department of Health had with ProLink, working with many of our local health departments throughout the pandemic to provide them with clinical resources, nurses and other clinical folks, and then make that available to the hospitals. At the end of the day, this is a hospital by hospital decision in terms of where can they best and most responsibly get their resources. The one nice thing about the ProLink relationship is if the hospitals choose to avail themselves of that resource, we know that that ProLink will be working to pull those healthcare resources from outside of Ohio, and therefore reducing the risk that inadvertently one hospital might actually be pulling very valuable and needed resources from a hospital in another Ohio community, which I know none of them want to do. But it's not the only resource available to them. There in many circumstances, will be staffing relationships that they have with companies already, and that they may be able to pull from. So this was part of our effort to add to their options and support even further their ability at this very challenging time, including the holidays, which are a staffing challenge any year for hospitals. We're aiming to add to the resources from which hospitals can pull.
Thank you, Dr. Vanderhoff. Our next question is from Tom Bosco with WSYX and WTTE.
Hi, Dr. Vanderhoff. Can you talk about schools? We saw one school in Central Ohio just sent out a tweet yesterday saying that in January they're planning to do away with their mask mandate. We've seen the governor ask schools to either resume or continue masking. What's your forecast for schools, especially after people gather for the holidays? Do you anticipate that parents should be preparing for online and at-home learning again sometime in the first quarter?
Well, thanks for that question, Tom. It's very, very clear from our experience and the research that keeping kids in school is something that needs to be a priority for all of us. And the governor has been very, very clear, and we've been very clear about our efforts to assure that kids can learn in person. And there are great tools available to do that. We have shown over and over again that the risk of transmission of COVID in our schools can be incredibly low, even in the face of widely circulating virus, if they take simple precautionary measures. And the foundation of those simple precautionary measures, of course, is getting vaccinated when someone is eligible to do so. And now, thankfully, most of our school students are in fact eligible for vaccination. And then right behind it is the safety and protection that we've demonstrated from masking and maintaining within reason social distancing and other good practices like hand washing. So I'm confident we have the tools to keep our kids in school with in-person learning if we avail ourselves of them. Frankly, if we reach a point where there is so much burden of illness in our communities that it prevents schools from being able to effectively keep our students in in-person learning, that's a shame because we have the necessary tools to prevent that.
Thank you, Dr. Vanderhoff. Our next question is from Dan DeRose with WOIO.
Good afternoon, doctors. Thanks for taking the time. Dr. Vanderhoff and Dr. Custodio being here in Northeast Ohio. Can you give us your level of nervousness, and let's call them out? I mean, the people who are unvaccinated, who are about to go to Christmas celebrations, whether they're traveling out of state or around the state, we're seeing the surge presumably from Thanksgiving right now. What is your level of nervousness if we are at a crisis situation right now about what it's going to look like in 2 weeks?
Thank you, Dan, for that question. I'll begin and then I'll turn it to my colleague. You know, we have said over and over again how important we know vaccination to be for protecting ourselves and our communities and those we care about. And we've also said how heartbreaking it is to us as healthcare providers to see people suffer and in too many circumstances die from an illness that we know is largely preventable by vaccination. That to know that so many of the people who are suffering in our hospitals and are dying need not be suffering in our hospitals and dying, that there is a step, vaccination, that they can take that will prevent that from happening. So it's very hard for us as healthcare providers, but our role, I believe, is to continue to provide people with the best information available, to continue to encourage them, to reassure them about what we know from the data in terms of safety and efficacy, even in the face of a changing virus, even in the face of the development of Omicron. The good news is we've got a tool that continues to work very, very well. It's very, very effective and something we can all be grateful for. Dr. Custodio, in terms of your experience there in Northeastern Ohio?
Yes, I'm not going to sugarcoat it. As Dr. Forrester said, we're concerned that the amount of patients that continue to present to the emergency department for COVID and even non-COVID related illness is pushing our very limits to provide the care. We will always provide safe, high quality care. It's just not necessarily in the same time frame that folks have become accustomed to. So, you know, I am nervous that we'll see this with schools taking mask mandates down, with unvaccinated folks traveling and getting exposed, that we will see the trailing effects of the holiday. But regardless of what comes, as we've said multiple times, our healthcare teams are resilient, and we've been here for the last 22 plus months, and we'll continue to be here to provide that care. But we will also strongly encourage everyone to do all that they can to prevent this from getting worse.
Thank you, Dr. Custodio. Our next question is from Brian Duggar with WTOL.
Hi, Dr. Vanderhoff, and also Dr. Custodio. You know, looking at the state dashboard, you can see the last couple of days, the Cleveland area, Akron area, they've had a huge jump in hospitalizations. Obviously, there's a Omicron outbreak in those areas. Is there any evidence that those hospitalizations are being caused by the Omicron variant? And if so, are those symptoms presenting any differently than Delta as far as severity?
Yeah, thanks for that question. You know, in real time, no one on the planet is able to provide genomic sequencing of a given patient's variant in terms of causation. But here's what we do know. We do know from surveillance that the cases of Omicron are very rapidly on the rise, especially in Northern Ohio. And there is no question that in the days and weeks to come, we'll reach a point where Omicron is now the new dominant variant. That's happened everywhere else that Omicron has gone. What I think we can look towards in terms of firm scientific information is what has happened in other places. And the information I shared regarding South Africa earlier in the press conference, I think is encouraging, but it is not definitive. What we do know is what has been happening during the last 2 months, driven by the Delta variant. And it has driven these substantial, remarkable numbers of hospital cases. Now we have another variant that's highly transmissible. And even if it turns out to be true that it causes proportionately fewer hospitalizations, if you've got so much more spread, we're still going to have great pressure on our hospitals. So it all circles back to the messages that we've been repeating and repeating, not only during this press conference, but in messages for the last period of months. We have to collectively take the steps that are needed to stop this, and it begins with vaccination. Dr. Custodio, what would you add?
Dr. Vanderhoff, I think you answered the question appropriately. We can't speak to what it will do, but I am concerned that just with the transmissibility and the sheer numbers that we're going to see, even if fewer are hospitalized, if the denominator is larger, we'll still have some concern.
Thank you. Our next question is from Abigail Botter with WKSU.
Hi, my question is for Dr. Vanderhoff. We're experiencing a shortage of COVID-19 tests in Northeast Ohio. I've talked to several health commissioners who say their county is out of the free tests to give out, and most grocery stores are out as well. Is the state able to send more tests to the counties anytime soon? And what should people do if they're unable to get tested before the holidays?
Well, thanks. Great questions. As I shared before, we are sending out unprecedented numbers of tests for the free tests. But I want to remind everyone that those are not the only tests available. There are many other places that people can get tests. Now, many of those tests will cost something, but they are coming down in price. So many of our retail locations have COVID-19 tests that you can purchase. You can also, of course, go to most medical providers, particularly if you're not feeling well. It would make sense to seek out medical care. And of course, our local health department. So, we're, I think, one of the states that has been most proactive in providing many points of access to these tests at a time like this, particularly as people are preparing for the holidays. So there may be situations where they can't easily find that test, particularly if they're taking it to screen prior to going to an event. In that circumstance, what I would ask is that we take a step back and ask, what does my risk profile look like? Am I fully vaccinated? If you're fully vaccinated, particularly if you're keeping up with your vaccines and are boosted, a fully vaccinated and boosted individual is very much less likely to even get sick in the first place or to transmit the virus very readily to other people. So, I think that increases your safety profile. The other thing you have to be thinking about is what kind of environment am I going into? Is it a small enclosed place that's going to have a lot of people? At this holiday season, whether you test it negative or not, I'm not sure that's the right decision. I think we need to look and say, yes, it's important for us to have that time with family and loved ones. It's important as human beings that we can gather, especially at a time like the holidays, but we have to do it in a smart way. Can we limit the size of the group? Can we have maybe multiple smaller gatherings where we can keep more distance? And can we wear a mask even when we're there? Can we crack a window, open up, get some ventilation? I'm told that we should have a fairly warm weekend this weekend. That might create more opportunity for people to open up the windows. So all those kinds of steps, I think, are options. Testing is a great screening method, but it's not perfect. And I don't think we should rely on a negative test to give us that clean bill to allow us to engage with abandon in our holiday parties. I've got two docs who work this day in and day out. Dr. Forrester, you're an infectious disease specialist. Maybe you could start.
Yeah, I completely agree with the masking, opening windows. The report today said Cincinnati's going to have 67-degree weather on Christmas, so maybe that is a great chance to open windows. And again, smaller and who you're going to be with. Again, if you can feel confident that those people are up to date on their vaccinations, is another way to protect yourself. I will reiterate that not all of the tests are created equal, and agree that while it's a piece of information that you can have and use in your risk assessment, they are not 100% perfect for sure. And just remember the flu is out there too. So we have had schools here in Cincinnati close because of the flu recently as well. And again, many of those tests are not going to, the COVID tests aren't going to check you for flu. So just keep in mind, but what does protect you is masking, the distancing, the washing your hands, and all the same things that we've already said.
I think my two colleagues, go ahead.
Go ahead, Dr. Custodio.
I said, I think my two colleagues covered that. I won't pile on.
It is now 12:01 p.m., so I believe that is all the time we have for questions today. Dr. Vanderhoff, I'll turn it back over to you for any closing remarks you'd like to share.
Well, thank you to my guests, each and every one of you, my two physician colleagues and Major General Harris. Thank you also to the press team for your very good questions and your continued focus on this. I wish everyone a safe and healthy holiday season.
Thank you. Stay positive, but test negative, right? So.
Yes, indeed.